All right, here we got an infiltrative thing. It's little basaloid islands, tadpoles in the dermis, right? So what would you do with this? Good. See, even on this one, which is actually pretty darn Morpheaform, but there's still some islands that begin to look more like regular basal. You tend to get more of that myxoid change in the stroma. I feel like these usually are pretty easy to diagnose most of the time. So this is a real good example of Morpheaform or sclerosing or just call them all infiltrative pattern basal cell to encompass all of the infiltrative patterns. But Morpheaform is another term that's used by many people. Real thin little cords of basal cell invading the dermis. When you see these, look for perineural invasion. It's often, I find it on a regular basis, a couple times a month. I feel like it's not on people's radar. They probably don't need like radiation or anything, but they do have to usually get wider margins on it when it takes them longer to clear if they do Mohs. So I usually like to at least comment on it if I find it. All right.